This broadcast is brought to you by Colby Brooks with Century 21 Right Pace Real Estate and buyfrombrooks.com. Let Colby Brooks handle all of your real estate needs. Next up on NEA Report, the latest Arkansas COVID-19 numbers are in. They have us at just under 2,500 confirmed cases. We're talking about that coming up. Plus, a concern from the Jonesboro Hobby Lobby as an employee contacts us and gives us some information we're going to bring to you anonymously and let you know about what they're worried about over there. And China claiming they have less active cases than Arkansas does. It's an incredulous claim, but it's on the website, Johns Hopkins, and when you take a look at that, plus our numbers that we received today, they're allegedly 200 below us, maybe a little bit more. It's a claim that we're not going to back up as far as credibility goes, but we are going to tell you about it next.
Reporting.
So let's take a look at the latest numbers from the Arkansas Department of Health's website, as their most recent update has Arkansas at 2,465 cumulative cases to date. That's with 902 recoveries, 45 deaths, and of course, you can see the United States totals there as well. These numbers were the ones revealed at the press conference this afternoon by the governor and the Secretary of Health, Dr. Nate Smith. Let's take a look at some of the numbers in counties in Northeast Arkansas, starting with Clay County, 1 positive, 143 negatives. In Randolph County, 14 positives, 402 negatives, 8 recoveries, 0 deaths. You'll notice a large jump in negative tests for a lot of counties. You're actually seeing the total tested number now up to just under 34,000. Fulton County, barely any tests still, negative 33, 0 positive. But over in Sharp County, 2 positives, 2 recoveries, 37 negatives. And in Izard County, 2 positives, 49 negatives, 2 recoveries. Taking a look at Greene County, 13 positives, 441 negatives, 3 recoveries. In Lawrence County, 30 positives, of course, a lot of those being in the nursing facility there, 196 negatives, 2 recoveries, and 1 death. Craighead County's numbers now over 50, 53 positive, with a lot of negative tests, though, 581 negatives, 28 recoveries, and 1 death. So before I move around with any other numbers, I want to take a look at this for a second, because if you look at the numbers of tests, like for instance, Clay County's 1 positive to 143 negative. Greene County's 13 positive to about 440 negative. Craighead County's 53 positive to about 580 negative. Those numbers are more representative, not necessarily always accurate based on if there's an outbreak at a facility, but more representative of how bad or good or basically where things are at in a specific county. Mississippi County, 9 positives, 76 negatives, 7 recoveries, 0 deaths. Crittenden County, of course, we've talked about that many times here, and their ratio is not good. In the Northeast Arkansas counties we're going to be going over here, they're pretty much at the worst as far as numbers go, with 152 positive to 770 negative, 72 recoveries, 5 deaths. Let's move over now to Cross County, where there's been 9 positives, 126 negatives, and 4 recoveries. Poinsett County at 13 positives with 75 negatives and 6 recoveries. Jackson County, 1 positive, they have recovered, and 49 negative tests. Independence County, 8 positives with 158 negatives, 4 recoveries. And I want to also mention Cleburne County, as we have several times, of course, because of how bad things were there. 71 positives, but that's out of 140 negatives. So as I was talking about those ratios of numbers, when you take a look at the numbers of tests total and how many positives there are in a specific county, that'll give you more of an idea of where things are at there. You know, again, when these numbers are so low, with the numbers being in the hundreds and not thousands for each county, it's tougher to say how accurate they are or how representative they are. But when you're seeing just about literally 50% of the tests in Cleburne County have been positive when you see these numbers, right? Or at least 50% of the negative tests have been positive, I should say, because it would actually be 140 plus 71. Right, because those are to-date tests, and they're not changed whenever there's been a death. Based on what we understand, these are not active numbers either. But then you say, take a look at Craighead County, it's a much different ratio, right? It's much lower positive to negative ratio. In Lawrence County, it's there's more positives perhaps than a lot of the smaller counties. That is because there's a nursing home outbreak there, and that has to be taken into account too. With recoveries today at 902, of course, cumulative cases at 2465. Again, deaths going up today. It rose to 45. Cumulative cases across the United States at 856,209, with 78,000 recoveries, basically, and 47,000 deaths. The number tested in Arkansas, as we've already mentioned, just under 34,000. NEA Report received a communication on Thursday from an employee of the Jonesboro Hobby Lobby that wished to remain anonymous while telling us about a situation that concerned them and apparently other employees there at the store. They said, quote, "My employer has made it clear that we are expendable." Very clear, they said. "We brought it to our manager's attention that we were not making enough to pay our bills, but making too much to draw unemployment. He relayed that to our district manager. We were later informed that our district manager said, quote, 'That's not my problem.' We have customers that aren't following social distancing and are pretending like nothing is going on. We are scared and we fear retaliation, but enough is enough. Our safety is not worth a craft store being open." Again, that's from an employee at the Jonesboro Hobby Lobby location, a store that has remained open, considering itself essential during these unusual times. A bit of an unusual consideration, and some in the city, for instance, and other locations have told me that they were scratching their heads about that. But Hobby Lobby, no stranger to controversy. And apparently here on the local level, not going to be either. A new campaign was announced by the Arkansas governor today at his press conference called the Arkansas Surge Campaign. And no, this is not an idea to get everybody to drink that green energy drink that was around in the late 90s. The hope is that more people are going to go get tested for COVID-19 because the capacity has increased. They got the backlog cleared out while at the same time increasing capacity with commercial labs and others. And now they're needing more Arkansans to get tested. So the governor says over the next 48 hours, if you think you have symptoms, that's his words, if you think you have symptoms, don't wait, get tested. And Dr. Nate Smith kind of echoing that as well, saying that Arkansas is not fully utilizing its testing capacity. So the hope is with more tests being given or taken by folks, there's more of an idea of where exactly we're going to be at and where we're going in Arkansas. So we're back on the coronavirus website from Johns Hopkins University. You can access this anytime at neareport.com or just go to coronavirus.jhu.edu, or just Google. I mean, that's out there too. The number of total cases as of our broadcast right now, 2.6 million. That's going to change as we go throughout the hours, as it always does. The United States makes up a big portion of that, 856,209. Now, the next 4 or 5, you can see nations combined get close to us, right? But it's the next 4 at least don't even equal the United States. So Spain at 213,000, Italy 189,000, France 157, Germany 151, the United Kingdom 139, Turkey at 101,000, Iran at 87,000, as according to them at least, China at 83,000, that's a lie, Russia at 62,000, then Brazil 46,000. If you keep going down, you'll see Canada's at 42, and Mexico, which is, of course, I'm bringing it up because it's on our southern border, is at about 10, but that's not necessarily representative of the amount of cases being tested. Sorry. The active cases are a different story. Now, these are the numbers of active cases, at least according to what testing data is available. You can see a lot more going on in Europe and nothing, basically, in China. What's going on with that? According to China, they say only 1,305 people have the coronavirus there right now. Okay? China, let's point that out real clear, carefully and clearly. China says less people in their country have the coronavirus than in Arkansas, according to the governor today. Some food for thought. Hopefully not bat soup food. So the number of incidences, you can see here the United States has a lot more data, and some of these countries are not going to have as much, right? That's just basically the way this is going to work. But this is kind of an idea of how many, at least, tests per 100,000 people and confirmed cases per 100,000 people they're seeing. Right here, you can see in New York, it's about 1,600. If you go to different locations, it's probably not going to be that high just about anywhere. Let's come to Arkansas, 94 per 100,000. Again, New York, 1,600. But take a look at the testing rate, too. This has been talked about quite a bit. I don't think New York's is actually on the map, or at least when I click right here, it says it's Vermont right there, and you don't see an option for New York State. We tried to find it. But so theirs would obviously be higher than any other states. That's the point of me trying to find theirs. But aside from theirs, take a look at some of the states nearby. 2,200 per 100,000 in Vermont. That's how many tests are being performed. 1,500 in Maine, jumping around Maryland, 1,300, West Virginia, 2,100, Florida, 1,300, and Arkansas is about 1,200. Arkansas is behind most states, but not all states in the South. South Carolina is at about 850, North Carolina 900. This gives you an idea. But then again, Arkansas is ahead of states like California, Colorado, Minnesota, and so forth. A lot of new data is available here that we've not had a chance to show you before as far as these maps go. Hospitalization rates, for example. In Kentucky, they're seeing a lot more people hospitalized than, for example, in Arkansas. Now, these numbers are cumulative hospitalizations. So, for example, today, when the Secretary of Health, Dr. Nate Smith, said that there had been 101 he said 101 are hospitalized, that means today. Doesn't mean the cumulative number, because to date, 291 have been in or are in a hospital. But of course, we know only 101 are hospitalized at this very moment, because some people have obviously rotated out, others have been admitted. The hospitalization rate in Arkansas, it says, is at about 12%. Jumping around, of course, in New York, 21%. New Hampshire, 13%. Florida, 15%. In California, about 13%. Some states have it lower than us, and we mentioned that before. Looks like the Dakotas, at least based on the info we're seeing here. Active cases, of course, this is only going to show based on country on this map, at least right now, so it's not really much use to us, but we talked about that locally kind of already. But this gives you an idea. As I said earlier, when you see the numbers showing that China claims to have 1,305 active cases. If that's true, that means nobody there has it anymore, because they have well over 1 billion people. But that's also why a lot of people have been skeptical of their numbers, because that would indicate that they have less folks that have it than in Arkansas. But you're here for the cumulative confirmed case numbers, right? And so let's go look at those in more detail. We've talked about those being in the New England states, there being a hot spot there, right? And we know that. There is a lot more testing there available, but not at the disparity that would change those numbers from being representative of at least how prevalent this is to a certain degree in the community. It's very clear the amount of testing is helping us see where this is at in our community, and it's not just showing how many people have it, right? There are different ratios in different areas, and in New York, for example, it's a bad ratio. And so there have been a number of cases there. I think this will actually show us, because it's hard to find the bubble itself, the right one to click, but there. 269,000 confirmed cases in New York so far, 95,000 in New Jersey, right? Those are more than China. Both have had, according to at least China, right? But according to some reports, maybe not. That's just according to their official numbers that they're giving to the World Health Organization, who's accepting them for some reason. Here at home, let's talk about this. Shelby County, Tennessee, about 2,000 cases, 43 deaths. That's why we've seen next door in Crittenden County, 149 confirmed cases with 5 deaths. The numbers, of course, you can see based on the counties, so they're all kind of evenly spaced out, but that's not actually, they're going to be scattered all about, right? These are just the dots based on the county. It shows you how many confirmed cases there are. Craighead's still showing to be at 52 as of this. And of course, we've told you a moment ago, they are at 53. This map's a little bit behind the state maps because it's aggregating data from a much broader sense. It's from every location in the world, not just in Arkansas. So that's why you'll see this one updated a little bit later sometimes. But the map shows, of course, down here in Lincoln County, where a lot of attention has been with the outbreak down there at 524, still not quite representative of all of the numbers that we think are going to be added to that over the next coming days, we should say. Pulaski County, 422, we see here in the central part of Arkansas. In Garland County, 109 cases. But you can use this anytime you want to find out just exactly how bad things are here, because they're not, at least compared to other places. I want to give you an idea, by the way. The big cities, St. Louis at 2,500 right now. Let's go down to New Orleans, where we're seeing about 6,000, and let's go to Miami. How about their location has about 10,000, right? But of course, that's nothing to New York, which has 270,000. It just shows you there are smaller hotspots that are out there, while there are locations that are not necessarily as hot. And those will, of course, be locations that are going to be probably opened up sooner. As we see that take place over the next several weeks, it's going to be interesting to see what happens on this map there. Thanks, everybody, for watching our coverage tonight on NEA Report. As we tell you a lot, it means a lot to us to have you in. If you think we did an okay job, we would appreciate a like or a share. If you've not already hit those buttons, hit them now. How about a subscribe or a follow? If you're not already a follower, we will try to keep you up to date every day with news, not opinions, no politics. We just try to respect you and give you the information so you can decide what's going on. And thanks, everybody that is a supporter of NEA Report. Of course, 99 cents a month, and you get exclusive access to stuff that we don't post here, exclusive shows every week, and also the good feeling of knowing you're keeping this thing going. Stan Morris reporting in Jonesboro, and you're up to date from NEA Report.